Hi, Sarah. Thank you
Hi.
so much for meeting with me. I super duper appreciate it, and as being someone that's near and dear to me, for you to be able to speak to our audience about what you do and what's going on during this pandemic is so appreciative. And I know you know who I am, but just to kind of reiterate, my name is Mirela. I am the public relations manager and the union liaison for Vogelzang Law, and we are a law firm that specializes in mesothelioma victims as well as any asbestos-related litigation. I really appreciate you talking to our audience and sharing a bit about what you do. So if you will, if you don't mind telling the audience a little bit about yourself and what you do and where you work.
Hi, everyone. I'm Sarah. I am a nurse at one of the hospitals in downtown Chicago, Illinois Masonic. I typically work on a unit that's called an observation floor, which is like an extension of the emergency room. We kind of help offload some of the patients that are there for 24 to 48 hours or less. Currently, my unit is one of the new COVID floors, so it's definitely been a change, but yeah.
Awesome. And how long have you been at Illinois Masonic?
So the short answer is 4 years, but the long answer is on and off closer to about 8 years. I started my nursing career there, did some travel nursing, and wanted to come back to Chicago, and was lucky enough to come back because I love it there. So.
Oh, fantastic. Well, they are definitely lucky to have you. And since you did mention that your floor is now the COVID floor, can I ask how this pandemic has affected you, not just professionally, but personally as well?
Professionally, it's just been like a total curve, just as far as what my day-to-day looks like, the types of patients that we're seeing, and just, even what I'm wearing to work. Obviously the scrubs are the same, but a lot of additional protective equipment. And then I would say, as far as personally, I've felt really supported through all of this, which has been amazing. But also I would say it has taken more of emotional toll than I would have originally thought of everything.
And you say you've had to add to your gear at work. Can you expand a little bit about what that looks like on a day-to-day basis?
Sure. So, based off of the guidelines, and it's been changing throughout. I've never read so many emails in my life. So we have, they call it PPE. I feel like a ton of people have started to hear that in the news because there's been all sorts of, do places have enough PPE? Do they not? I'm very grateful that I do. Our hospital has been really transparent about all of that, which has been great. But I wear a specialized mask called an N95 mask when I'm seeing patients. And then to protect ourselves from each other, we wear just regular surgical masks throughout the day. We have eye protection, and then we have like a specific gown that we place and do something called donning and doffing, which is just the proper way to put it on and take it off before seeing the patients. So.
Wow, that sounds complicated.
Yes, we have all sorts of like step-by-step guidelines to go through it. When it initially happened, that was definitely kind of a anxiety, like, oh, am I doing it right? Am I not? But now I feel like everyone on our unit has very much gotten the flow of it, and it's been good.
That's good. And you said personally, you've been supported, and Lord knows I have said it to you, and I've said it to colleagues and anybody that'll listen. I'm so proud to call you my friend and to say that, you're on the front lines and you're protecting us. It's definitely taken an emotional toll. And if you don't mind maybe expanding a little bit on how it's taken, since you are so much right there in the front.
Yeah, absolutely. I think as far as physically what I do as a nurse, and like giving patients their medications, helping them do their daily routines, the things that they need to do, or physical therapy, all of those things I'm used to doing. I'm able to do, even talking to families on the phone, I'm used to that, but the emotional part of it now that no one's family can visit, with the understanding that it's to protect them and to protect everyone in the community, to kind of flatten this curve. But, you know, having multiple calls with family members that are concerned about things, you know, having patients that are end of life, and, you know, we do have specific policies that have some exceptions for that, but, you know, doing the video calls with family that I know would be there if they could be there, and, you know, hearing them say such touching, loving things to their family members, and then, you know, not them being able to have that physical part is hard. It's hard to witness.
Well, my heart definitely goes out to you, and you're a superstar. So, and this is probably a hard thing to answer, but in the beginning stages, you said, you know, there were so many policies and emails that you were getting. Would you say there was one moment that you felt, okay, this is going to take a turn, and this is maybe going towards the worst? Like, was there, and then if you could kind of describe what that looked like for you, for your fellow nurses in the hospital, if there really was a moment that said, okay, you know, this is kind of going from bad to worse, if you will.
I think we've been really lucky just in the fact that because we had, you know, I think because it hit America later, and this is just personal thoughts, but because it hit America later, I think we had a lot more time to prepare.
Okay.
And even our hospital, before it got to us, had a lot of plans in place of, okay, so if this area starts to fill up, then we're going to open up a new unit for this, or we're going to open up a new unit for this. And that was all laid out.
Oh, that's awesome.
Yeah, pretty much beforehand. So, I mean, some of it was like a day-to-day, are we going to have to open this unit? But even reading those emails, it was like, okay, thank goodness they have a plan. We have a plan, but also like, wow, this really is going to change a lot. Our unit was the first official COVID unit. Mm-hmm. And I think nurses on my unit kind of knew, just because of the type of rooms that we have. We have more isolation rooms. So before it even happened, we kind of were figuring that was going to happen. And then I think if there were to be one moment, it was when they officially announced that we were like, oh, okay, wow, yeah, the change is here.
You're on. I can imagine. Which actually kind of brings me to my next question is, I can imagine the environment in the hospital has changed, but how is it like now as opposed to before the pandemic, especially with your fellow nurses and maybe specifically on your floor?
I would say our unit has always been, like, we've always had great teamwork, but I feel like this has made it really shine. Just in the fact that it's like, okay, if someone's in a room, like, we're going to get them everything that they need, because we want that time to be limited, to limit their exposure. I love that my hospital is like kind of more of a smaller community hospital. It's grown a lot, but especially being part of a bigger organization, but it still has that small feel. So even just feeling like stronger camaraderie with some of the doctors, with some of the other specialties, I feel like respiratory therapists are the absolute unsung heroes of all of this, because they are the ones that are like doing everything with the ventilators. They are the ones that are monitoring so many things. And so even being able to partner with them, and I feel like my learning curve has just gone up with so many different respiratory things, and they've been really just right there to support everyone else as well.
Oh, that's awesome. That's really, really great to hear. You know, as it sits now, you know, we hear the updates every single day. Being in there and being in the midst of it, do you feel that we're improving, or do you still think that, you know, the peak, if you will, might still be climbing up as opposed to going down, in your professional opinion?
From the data from our hospital, it looks like it's at least leveling off.
Great.
So we're hoping for that. And we haven't necessarily seen that downtrend yet at this point, but we're hopeful for that. So we haven't had to open any more of the surge units, which has been a very good sign.
Awesome.
And we've kind of been at that level for a while. So.
Oh, awesome.
Mm-hmm.
And it's my hospital too. So that's where I go.
Oh, there you go. Good.
So as I mentioned, our clients at Vogelsang Law, we specialize in mesothelioma victims, or folks that have lung cancer from asbestos exposure that obviously deals with the respiratory system. So in that respect, those people that are immunocompromised and, they still have to get treatments, or they still have to see their doctor, what advice could you give to those people that are watching and that are like, I have this disease, I shouldn't go out, but I still need to get treatment?
Obviously be listening to the shelter in place, staying home if you're not going to treatments, really limiting who you're seeing, which I know is really hard in this time.
Sure.
But even if someone else, like, especially for like going out for groceries and stuff like that, doing things like Instacart, or if you don't have the means for that, if someone can bring them to you, if someone from your family can do that for you, because those are the areas that we're seeing that people are getting it more, is when they're in the community. And then obviously watching your own symptoms, talking to your doctors. I know that they're doing some sort of screening, because I'm not with the cancer center. I'm not sure exactly. But I know that they are doing some sort of screening, because we have had patients come to be tested just as a precautionary thing based off of some of their symptoms. So having that close communication, obviously, if you're feeling sick, talking to your doctor before you're going to your treatments. Some of, like a fever can be a symptom after a treatment, just of your treatment. So talking to your doctor about what they think is best, whether they think you should go to the ER or whether you should be monitoring things at home.
And then for the whole cancer community, those who are lucky enough to either be in remission or towards the tail end of their treatments, where maybe those treatments aren't a necessity, can you speak a little bit about telemedicine?
I know that our outpatient centers are doing a lot more of that. Okay. As far as especially if you think, that's something I would say I would start with. Mm-hmm. Talking to your doctors on the phone, talking to their offices, or doing video calls like this with telemedicine. And then it's ultimately up to the provider if they feel like they need to still physically see you. Mm-hmm. But I think that's been one thing that's been really helpful during this time. Awesome. Especially if you are more immunocompromised, that keeps you safer.
Lastly, what message would you like to tell our audience coming from the front line?
Just to everyone that's been staying home, thank you so much. You're helping us. It's really honestly been encouraging for me to see, because I'm able to see the numbers. We're starting to see patients that were intubated be extubated. Which is huge. So we are seeing good signs for the end of this. I know as it's getting nicer out, it's going to be harder to do, but please be listening. Please continue to do that as long as they're talking about it, because that's what's working. We're seeing data now that it's working. And I know that everyone wants to get out there and enjoy summer. So do I. But the longer that we stay in like this for the short term, the more we're going to be able to enjoy it.
Sarah, thank you so much from all of us at Vogelsang Law. We're so happy that you are on the front lines. Thank you so very, very much that you took an opportunity and to sit down and chat with us. So thank you so much. Stay safe and stay healthy. And we really, really appreciate everything you do.